So we started gastrointestinal tract. Okay. So basically, whatever system we are going to study, basically we need to specific type of symptoms related to the organ. Like in pulmonology, we have three main symptoms like cough, shortness of breath, breathing difficulty. Okay, these are the some symptoms which can be related to the organ directly. So likewise, in the gastrointestinal tract, okay, we have some symptoms. After that identification, we'll able to understand that those symptoms will related to the gastrointestinal tract, GI tract. So what are those symptoms? Main symptoms, main symptoms of GIT. Okay, what are those main symptoms? First and very important symptoms, okay, that is abdominal pain. The abdominal pain is a main and it is related to the GI tract condition. Okay, it may be there are a number of organs in abdomen. Okay, like liver, gallbladder, pancreas, stomach, small intestine, large intestine, pelvic region. Okay, so we have gallstone, kidney stone, pancreatitis. Okay, it may be possible of appendicitis, gallstones, pancreatitis. Okay, ulcer, esophagitis, GI obstruction. Okay, function of bowel disorder or renal stone. All this will have these possibilities for abdominal pain. Okay. Next is the second important symptom which is related to the gastrointestinal tract. That is heartburn. Heartburn. Okay. Heartburn is a thing which is related mostly to the esophagus and epigastric region. Okay. Epigastritis mostly it involved. Okay. Abdominal wall is affected due to the hyperacidity, okay, or gastro reflux disease. Okay, these are the symptoms of heartburn. Next, the third one is the symptom which is related to the gastrointestinal tract is nausea and vomiting. Okay, the third symptom, nausea. It may be from the stomach also. It is due to the liver problem, okay, due to the ulcer issues, okay, due to the any motor issues, okay, due to the pregnancy sometimes or endocrine disorders, due to the motion sickness, okay, while traveling, or any related disease of central nervous system. Okay, so nausea have this much possibilities of diseases. Okay, next is altered bowel habits. Means mostly constipation. Mostly constipation. Okay, due to the GI tract in GI tract problem, we have mostly large intestine and small intestine. So we have three three categories of functions of GIT. That is one, digestion, absorption, and defecation, removal of harmful substance. Why this happening? Because sometimes the fecal matter will does not evacuate completely. Okay, sometimes hard stools. Okay, sometimes you need to give straining during defecation. Okay, or sometimes passage of loose and watery stools. Okay, these are the are incomplete evacuation, altered bowel habits. We have diarrhea, infection, any inflammation in the large intestine, all malabsorption, taking of medications. Okay, all these are possibilities of altered bowel habits. Okay. Next, we have fifth level, GI bleeding, gastrointestinal bleeding. It's also one of the main symptoms. Why the GI bleeding happens? Okay, due to the ulcer. Main reason of GI bleeding is ulcer or esophagitis. Okay, or any rupture of veins and arteries, or any lesion, or any non-cancerous growth. Okay, hemorrhoid, fissures, or any inflammatory bowel disease, or any infection in the stomach or in the small intestine, large intestine. These are the reasons, possibilities of GI bleeding. This is one important symptoms. There's another important symptoms is jaundice. Jaundice. We will also call obstructive jaundice or jaundice. It may be due to the gallbladder issues or liver issues. It will clearly shows the problem in the liver, gallbladder, primarily liver, secondary gallbladder, and third, it is due to the it is due maybe due to the uh, pancreas also. Okay, so we have to examine that. Okay, this is very very important. Next, other symptoms. What are the other symptoms related to the gastrointestinal tract? Is dysphagia, difficulty in uh, swallowing, okay, difficulty in swallowing, dysphagia. We have uh, heaviness in chest region after eating food. This is one of the symptoms. Okay, weight loss. Weight loss is also one of the problem. Maybe due to the gastrointestinal problem, fever sometime with abdominal pain. Okay, so these are the we have sometimes gum bleed due to the bleeding or ulcer stomatitis means ulcer on the tongue. These are the things, stomatitis, gum bleeding, it is due to the malabsorption, due to the deficiency of vitamins. Okay. So these are the main symptoms is still jaundice. After that, some patients will react to, some person will affect that, some person will not. Okay. So these are the main symptoms related to gastrointestinal tract, abdominal pain. So you have to mention in the column, heartburn, nausea and vomiting, altered bowel habits. You have to discuss with the patient altered bowel habits. You are getting the motion. So some patient will have after eating food, they will go to the washroom. They have the bathroom. Okay. GI bleeding, jaundice, difficulty in swallowing, weight loss, fever, gum bleeding, stomatitis. These are the simple reported symptoms related to gastrointestinal tract. So basically, these are the things. Now, what are the these are the symptoms? What are the tests which are involved to check about the GI tract? Okay, so we have number of scans related to the okay, tests related to GIT. First is laboratory test, lab test according to the condition. Okay. Uh, if the bleeding is happening, example, urine test uh, HB percentage. If the bleeding is most, that means your HB percent will decrease. Okay, B12, vitamin D3, vitamin C. So because all this will absorb in the small intestine. If there are less, it means there is a problem in the absorption capacity of the intestine, which indicates. And we have laboratory tests and we have the radiographic test. Radiographic tests. Okay. In the radiographic test, we have ultrasound. Okay. What we have? Ultrasound. Ultrasound, endoscopy. Okay. Colonoscopy. Okay. And we have sometimes we have capsule endoscopy also is there. We're able to swallow one capsule and it will capture all the problems in the from mouth to anus. Or balloon endoscopy we have. Endoscopic ultrasound, both endoscope and ultrasound we have to do sometimes. Okay. And we have one endoscopic retrograde cholangioscopy pancreatography. This is one of the tests. Colonoscopy, upper endoscopy, lower endoscopy. Okay, mostly these tests are involved. Sometimes you have to advise to do CT abdomen, CT abdomen, uh, normal and contrast. Means contrast, you have to give them an injection. It will go to the specific abdomen area, or you have to swallow the given water, and after that you have to take the CT scans. So you'll get the picture. Sometimes you have to give MRI. Okay, MRI also MRI abdomen or MR. Okay, MR colonography. Okay, these are the scans which are advised by the doctors to check the problem in the GI tract. So, according to the condition, we have to advise the patient if the problem is not diagnosed during the examination. Okay, these are the radiological diagnosis. Okay, these are the radiological diagnosis. So these are the things we have to remember about the symptoms, about the related tests. Okay, so all this will be done in the presence of uh, radiologist. This is all about in today's class. We'll discuss further in next class.